Well, I hope everyone can hear and see me okay and that our links are still working appropriately. If not, somebody send me a chat message or let me know so I can hold on for a minute, but I'm assuming we are good to go ahead and proceed. As Paul mentioned, today we are going to be talking about carpal tunnel syndrome and how it affects farm workers, farmers, and ranchers, and how we can help to identify the different tasks that are associated with carpal tunnel syndrome, treatment methods, and assistive technologies. So you're going to hear a little bit about the actual disease of carpal tunnel from me, and then we'll move on to Ned's part, and Ned is going to cover the assistive technologies and some of the modifications of tools that can help with carpal tunnel. So as we get started, the first thing I want to draw your attention to is some of the images on the screen, and you'll notice that the one thing they all have in common is a general sense of repetition. The jobs that we might see sometimes on the farm include a lot of gripping and twisting and turning that have a lot of repetition, whether that's pruning or using carpentry tools or plumbing tools, mechanics wrenches on machinery, harvesting different types of crops. That repetition is often what is generally known to start to be a precursor for carpal tunnel syndrome. Now, we can also think about some of those forms of repetition as just being a precursor to different forms of arthritis in the hand joints as well, and that's absolutely true. And now, while carpal tunnel is generally kind of loosely associated with arthritis, because it doesn't actually involve the bones and the parts of the joint, it's not considered an actual form of arthritis. It's just very closely related. So we'll go into a little of an overview of carpal tunnel syndrome, and basically what's happening, and you'll see in a photo on the next slide, is that there is a nerve that runs lengthwise from the elbow down into the wrist. It's called the median nerve, and it goes through a very narrow channel in the wrist, and that channel or that tunnel is what is actually called the carpal tunnel. And it's a very narrow space. It has a lot of different parts running through it, as you can see in this photo. It shows the tunnel part that goes sideways across the wrist, the transverse part, and then all of those tendons and ligaments and that median nerve go underneath that area. If for some reason that tunnel becomes narrowed, or if it becomes injured or inflamed at some point, it's going to put a lot of pressure on that median nerve. So as you see in this image here, we have that median nerve being compressed, which is going to cause numbness, it's going to cause pain, it's going to cause a tingling sensation in the hand, sometimes running all the way up from the tips of the fingers up into the shoulder. And that's caused by several different instances, things that could affect that, and it's going to affect everyone a little bit differently. No one is going to have the exact same response to that pressure being applied to that median nerve. Some of the possible causes are still really out for research, because with carpal tunnel, again, as I said, everyone is going to be affected a little bit differently. It could be a congenital relationship to where the tunnel is just naturally small and it doesn't have a lot of room for that median nerve, so it presses and puts pressure on it, causing pain. It could be from injury or swelling of the wrist, or even fluid retention. Sometimes women who are pregnant tend to see more pain associated with carpal tunnel because there's fluid built up in there. Now, for agricultural relationships, for what we're considering, it's generally going to be that repetitive wrist motion or those overuse type motions that are going to inflame that area or cause a pressure to be applied to that median nerve. But it's also coming from having your wrist in an unnatural angle for a long amount of time, whether you're holding a tool in a certain angle that's not natural for your wrist, or perhaps you're working at a tool bench or even at your laptop computer where you're putting your wrist in an unnatural angle. All of those are possible causes, but there isn't a specific one cause that everyone can associate with carpal tunnel. Some of the statistics related to CTS. It is estimated that 1 in every 10 Americans has some form of carpal tunnel symptom. That could be pain in one person, it could be a tingling sensation, or even numbness. Some people have been known to report that they would be gripping a glass in the kitchen and all of a sudden their hand would just open and drop whatever they're holding because that numbness, or their hands would just react to not being able to grip. Others report severe pain in the evenings or at nighttime. So lots of different symptoms in those 3% of Americans. The ratio is 4 to 1 for females to males. that have been reported through research, and most often it's going to occur in people who are 30 to 60 years of age. Now, much like osteoarthritis with the age range there, it doesn't have to be a disease of aging. It's simply based on what your body is capable of. It's based on what you have done with your body and how many years have you worked in a certain position with that repetitive motion or those unnatural angles. So it could show up much earlier than 30 years of age, or it could show up much later in life as well. The progression is often very slow at first with carpal tunnel. It isn't something that will just show up overnight and be very severe, but most people will start to notice some symptoms that come and go. About a third of the people show that those symptoms go away naturally on their own after giving their wrists some rest or putting some ice or using an over-the-counter medication, but it can become a very severe issue. Some of the other things you might have heard carpal tunnel be called because of these symptoms are things like handcuff neuropathy, keyboarder's disease, nocturnal paralysis, again, when things generally happen, that pain comes at night. Now, one of the things that they might also notice is that there are different ways to relieve that pressure and that pain, and we'll talk a little bit about pain management on a few other slides, but one of the symptoms that you might see from a person with carpal tunnel is that they tend to flick their wrists or they shake their hands, trying to bring some of that feeling back, trying to relieve some of that pain and pressure on that median nerve. And while that might be a very instantaneous relief of that pressure, it is absolutely not going to be a good way to treat that pain or that carpal tunnel disease. But that is a sign or a symptom that you can generally identify in some people. The limitations that can come about from carpal tunnel, if it's not treated, could eventually get to an atrophy of the muscles, an abduction of the muscles in the thumb area where you can't grip and you can't bend your hands anymore. Other limitations could go as far as not being able to grip or grab onto anything that has a narrow diameter grip because the hands can't physically move in that general way because of the pain that's so severe from the wrist. So you'll start to see a different limitation level for each person depending on how severe their pain really is. One of the things that this brings to mind is, when is it time to determine, can you handle the pain of carpal tunnel on your own, or do you need to go in and see a doctor? And the general rule of thumb is very similar for osteoarthritis, for those of you who have heard some of our other webinars, but when you first start to feel that pain, it's fine to treat it with an over-the-counter medication or an ice pack or a topical ointment. With carpal tunnel, wrist braces are going to be very popular as well. But if that pain is persistent, anywhere from 1 week to 2 weeks, some people will go longer before they realize it has been fairly consistent, it's time to find a general practitioner, go in and see your doctor. One easy way to do this is to start journaling when the pain occurs, whether it's at night or during the day, writing down what type of tasks you're having difficulty accomplishing and what type of pain you're having. Is it a severe sharp pain? Is it a numbness, or is it the tingling pins and needles sensation? Writing down those types of symptoms, the occurrence and how often it happens and how long it's happened will greatly benefit your general practitioner when they go to help you diagnose whether you have carpal tunnel and then what your treatment plan is going to be. Some of those methods of diagnosis, there are several different forms that a physician can use, but the most common ones are going to be called the Tinnell's sign, which is the photo on the bottom left. And basically this is a percussion test where they're going to press on that actual median nerve in that carpal tunnel area to see if you're going to have any tingling or pain sensation. About 60 to 70% of people with carpal tunnel will have that tingling sensation show up when you directly push on the median nerve. The Phelan's test, the two photos on the right, are actually more of a wrist flexion test, and this is a more accurate test of carpal tunnel because generally 80 to 90% of people have a very severe pain or tingling or numbness when you try to bend your wrist at those different 90-degree angles from your forearms and up into your hands. So as you start to progress into being able to bend your wrist that way, if you put your hands together now, you'll notice at what point it becomes difficult to bend those and you'll start to feel a little bit of stress. A person with carpal tunnel will start to feel that pain and stress much more quickly, and they'll have a stronger reaction to that carpal tunnel pain. Other diagnoses that sometimes get misdiagnosed for carpal tunnel are things like rheumatoid arthritis, tendinitis, and even different forms of a neuropathy with diabetes. So again, while it's so important to see a doctor is to determine, is this pain simply due to that median nerve being compressed and causing pain, or are there other issues happening in the joints of the wrist that need to be considered? So there are sometimes some co-diagnosis or even incorrect diagnosis depending on how accurate your pain level is. So once it has been determined that you either do have carpal tunnel or maybe you are at risk, there are some different treatments that are going to be available. Most of them can be adequately treated with very conservative methods, not requiring surgery or even injections. Those moderate methods are things like just rest and doing general therapy, stretching, doing exercises using different textures of ball grips and using different hand strengthening tools that a physician or a physical therapist could give you. Neutral position splints are often very, very helpful with carpal, and we'll see some of those in one of the next slides. NSAIDs, non-steroidal anti-inflammatories, the same type of over-the-counter medications or prescription medications that you might see for other forms of arthritis, things like Aleve and ibuprofen, anything that's going to reduce the inflammation off of that nerve. There are steroid injections that are very short-term relief. Obviously, you would have to do a steroid injection much less frequently than you would have to take an over-the-counter medication, but it is not going to be a permanent option for pain relief. Different ergonomics, and you'll hear Ned talk a little bit about those later as well, as far as grip position and grip diameter and the natural position that your wrist should be in. And then even things like ultrasound therapy could help with carpal tunnel. But again, none of these are going to be perfect for every person because each individual case is going to be very unique. So if those conservative methods don't work, there are some options for a little more advanced treatment, things like the steroid injections and surgery. And when we look into some of those a little bit later, you'll actually see, what some of the risks involved are and how often maybe that should be a consideration. So in general, some of those ergonomic measures are things like avoiding that repetitive wrist and hand motions. If you find yourself working with a tool in the shop and it's taking you a long time, 10 or 15 minutes, take a break. Stop and let your wrist return to that natural position. Find a way to give it some rest or stretch your fingers back out to stretch those tendons and ligaments. Try to avoid using vibrating hand tools or any excessive grip when you're using those types of machinery. If you can't avoid it, finding some assistive technology, like you'll see later, to help with that. Other ways to relieve symptoms could just be to use any type of assistive devices that are going to be available, finding different ways to determine your own personal grip strength, your own personal grip diameter. Tools are not universal in their handles. A woman's grip is going to be generally smaller than a man's, so knowing what your physical limitations and capabilities are is going to go a long way towards those general measures of pain management. The wrist splinter braces are fairly self-explanatory. They are going to help reduce inflammation and irritation by keeping that wrist area still and not allowing for a lot of flexibility and movement. So there are going to be different times that a person would wear these splints and different reasons they would wear them. Some people say, we can't wear them during the day. I can't work in a splint. And, that's perfectly understandable. But for people who do, finding a soft, flexible wrist splint that you could still wear while you're doing your job would be very beneficial. If that's not an option, it's very important to consider a very strict regimen of wearing a harder, more durable wrist splint in the evenings and when you sleep. It has been shown that with carpal tunnel, you have a lot of increased pain at night, and that tends to sometimes wake people up out of a sleep because the pain is so severe. So finding a way to wear those immobile, harder splints in the evenings and at bedtime to be able to immobilize that wrist as much as possible. You can also put those topical creams and ointments on underneath those and on your skin before you put a wrist splint on, which is going to help, again, just to maintain some of that pain control. There are two different types of splints that you can find. There are several over-the-counters that you can pick up at your local pharmacy or your local general stores that come in different pre-fit sizes, so small, medium, large. Or you can also go and see a physical therapist or an occupational therapist who will actually measure your own hand. And they will be able to fit that splint very specifically to apply the pressure where it's needed on that area of the wrist. So again, it's going to depend on the level of severity and what your general practitioner recommends before you decide to work your way into a splint. Some of the general pain medication, just the over-the-counter anti-inflammatories, again, the topical creams that, you're going to see a lot of eucalyptus and smell a lot of eucalyptus in these creams because it has that cooling and pain receptors that will help to take away some of that just general pain. It's not really going to help with the tingling or the numbness so much. But you can also look into, having a supplement like vitamin B6 added to your diet, or just as an over-the-counter vitamin each day. And then sometimes a physician will actually decide that they want to give you a prescription for a corticosteroid or, some sort of orally administered drug that's a little bit stronger than just a general over-the-counter medication. If a local injection is an option, it's going to be an injection of lidocaine and prednisone. It's going to be something that is, again, injected right into that median nerve and right into that carpal tunnel area for a very immediate relief of severe pain. And it will generally last a few months, depending on what that person continues to do with their wrist. If you go right back to a strenuous working environment, it's not going to help as much as it should. The general rule of thumb is that if you have to have more than 2 lidocaine or prednisone injections per year, it's probably time to look into even a surgical option to control your carpal tunnel. So that surgical option is generally something that most people try to avoid because it is not a very simple surgery to recover from just because of the movement of the wrist. It's hard to keep it immobile, and it does have a pretty good recovery time. But what's going to happen is that, they're basically going to go into the wrist and they're going to cut that tunnel or that transverse ligament that covers the median nerve to allow that nerve to have more freedom of movement so it's not compressing and causing that pressure. There's about a 90% success rate of the surgery and only a very, very small 2% complication rate for the most part, because there's always going to be things like, infection and muscle weakness. And with carpal tunnel surgery, the biggest complication is usually scarring, and that's an issue that most people don't want to deal with. But depending on the severity of your carpal tunnel and how far it's progressed, that might be your only option left. So moving this into the next part of our webinar, you can see on this slide some of the agricultural tasks that might be associated with the repetitive overuse motions, the twisting and the flexion, and the unnatural angles. Things like gripping steering wheels and the controls in farm machinery for long periods of time. Carpentry or plumbing work in farms and on machinery and in livestock operations, or even using hand tools, like a socket set or a wrench when you're working on machinery. Some things people don't really consider all the time, but things if you use an ATV quite often, you've got a lot of throttle usage that's going to use a lot of your thumb muscles, and eventually if that thumb muscle builds up to the point where it's irritating, it can rub on that median nerve as well. Pruning, any type of orchards or fruit trees or anything that you might need to use those pruners for. Picking and harvesting different crops is obviously something that's going to require a lot of hand repetitive motions and movements. Things like farrier work. People who work with horses, you see them having to grip a lot of different tools and twist and turn their wrists at unnatural angles to get at all levels of that horse's hoof. So there are several different ways that we can associate carpal tunnel with these type of tasks on the farm, and by all means, we're not going to be able to give you a full list today. But what we're going to do now is turn this over to Ned, and he's going to talk to you about the assistive technologies and some of the modifications to these tools that can be very useful for a person who's battling carpal tunnel. So with that, I'm going to pass it over to Ned, and then we will continue on.
Thank you, Amber. Here in Michigan, we have quite a range of agriculture. There is a large amount of fruit and vegetable production, especially on the west side of Michigan, close to the lake, and it's very common for the growers to have issues with their hands. And you'll notice in the title of this webinar, it was coping with carpal tunnel and arthritis. And it's that way because much of the assistive technology we're going to talk about would serve whether someone has arthritis in their hands or if they have carpal tunnel. So you probably have, if you know a farmer, if you are a farmer, if you work with farmers, recognize the challenge that they have quitting work when it hurts. And quite often here in Michigan, I'll have a farmer tell me that if he overworks on one day, he really has to pay for it, and he might end up on the couch for maybe the next 2 or 3 days, just recovering from that. And so the assistive technology that we're going to talk about here, as soon as Amber gives me the ability to switch slides, we'll move on. But our goal is to help the farmer stay off the couch and be productive and do as much as he can without overdoing it on a given day. So this is not where we want our farmers and growers to be, because when they're in this position, they're hiring all their work done, or their families are doing it for them, and it is not a productive position unless all the work is done, maybe on a Thanksgiving afternoon. But we're going to help our farmers think through what's the smartest way to accommodate this. Now, with the repetition issue, there's really no way to solve that on a fruit and vegetable growing operation. When you have bushels and bushels of tomatoes to pick or an acre of vines to prune. But what we can do is look at, is this a very important task that has to be done? Is there another way that the task could be accomplished that wouldn't require the repetitive motion of your hand? Or could the task be traded with someone else? Those are really the feasible ways to deal with the repetition. But then we move on from there at what kind of a tool would reduce the pain associated with that task? Is there a way to adapt a tool that's already on the market? Or if necessary, can we design something new from the ground up that could reduce the pain and help the grower do his own work more efficiently? So I'd like to talk today, like Amber said, the range of tasks on a farm are innumerable. I don't think we could address them in 3 years, but we're going to just talk about several that are common here in Michigan and probably in other parts of the nation as well. But transplanting small seedlings from a large flat and putting them into individual pots, pruning and harvesting vegetables and fruit crops, using hand tools. We're going to talk about the issue of vibration and power tools. And then at the very end, we're going to talk about tractors in general, a little bit beyond just the issues of the hands, because tractors are so commonly used on our operations here in Michigan and the impacts of arthritis. So this is a picture of a greenhouse worker. There is a resource very well done from Mississippi State University. Scott Langlois put it together. It's called the 3 E's of greenhouse safety, and I'm going to put a link there. I sent it to the chat window for Scott, because his work is very well done, and it could be used in your states as a training piece for helping workers that have carpal tunnel or arthritis issues to learn safe work habits in the greenhouses. So take a look at that after the webinar and see if you can learn from it as we have here in Michigan. So this is a picture. Remember how Amber showed us the test to see if you have carpal tunnel and how the workers had to press their hands together like this to see if it hurt. That's the exact position that this worker is in this photograph, pressing these seedlings into the pots. You can see where carpal tunnel is going to cause severe pain to this worker. As well as here, we look at when the arms are up in a position like that and we're twisting our hands to pull the seedlings out of the flats, how difficult this could be. A recommendation, it's not very expensive, that can really help a worker in a greenhouse, is if this worker could take that flat of plants and put a brick on the far side of it, underneath it, and prop that flat up so that it is facing her at an angle, she'll be able to reach in and press and pull out seedlings and press them into the pot with her wrist at a neutral angle. Another simple solution is get a chair that can adjust up and down so that you are at a proper position at the table in the first place. That can make a big difference in safe working practices in the greenhouses. And once again, it's a pretty low-cost accommodation. If you remember when Amber was talking about the wrist splints and braces that would help hold a person's wrist in a neutral position, basically wearing those splints forces you to adjust your workstation. It forces you to use appropriate ergonomics with your hands and wrists to keep that wrist in a neutral position and reduce the pain caused by the carpal tunnel, as well as reducing the likelihood of worsening the condition or causing it in the first place. So we always urge and encourage and help growers get those braces and wear them frequently. The pruning and harvesting, once again, that's going to happen thousands of times in a day, whether it is picking sweet corn, whether it is trimming blueberry bushes, grapevines, tomato vines, and the typical pruner is held in one hand like a scissors, and it's squeezed with one hand in the same position. The repetition is intense. And so we have to think this task still needs to be done 1,000 times in the next 6 hours. How can we reduce that repetition? And a tool like this one here allows the grower to work with two hands. He can squeeze this with the left hand, he can squeeze it with the right hand, or he can squeeze it with both hands. And right there, you have reduced this from 1,000 times to 500, or maybe 333. If we can change the method, we have reduced the repetition, not of the task, but of the way the task is done with the hands. This is another example. For $3.80, you can purchase a knife that fits on a finger like a ring. It can go on the inside of the palm, or it can go on the outside as shown in this image. And this finger knife can be used for pruning tomato plants. It can be used in even picking tomatoes if a person is having a severe issue of carpal tunnel and the reaching with the hand and twisting the wrist to pluck off the fruit is causing an issue. Even a simple knife where I can hold the tomato with one hand and I can cut with the finger knife the other. We have changed the motion, and we are actually resting those muscles and ligaments just by using a different process. Guaranteed, when you go talk to your grower and you suggest, let's use a finger knife, oh, that's going to slow me way down. Or, here, did you ever think of holding the pruner in your left hand for 10 minutes a day or 10 minutes an hour? Oh, I'm too slow with my left hand. I can't do that. Well, when we go back and think about, you might be sitting on the couch all day tomorrow because you overworked your right hand today. Now think about how much is it going to slow you down. If you have to work at a slower pace for 10 minutes each hour, as opposed to not working at all tomorrow because you're in such severe pain, what really is wasting your time, or what is slow? So we have to work with our growers and encourage them to try these new methods. And the fact is, once you practice, say, with a finger knife or a different style pruner that you can use with the left hand or the right hand, the speed does pick up as the grower gains new skill in using those tools. Here's another example of a way to keep a wrist in a neutral position. These right angle knives can be purchased from many places, arthritis supplies. You'll notice here that this knife, not only does it allow the worker to keep his wrist or her wrist in a straight neutral position, it's a nice fat handle. And you remember Amber spoke about some of the exacerbating factors of carpal tunnel. Squeezing a very small diameter tool is going to really increase that pain. So if we could help a grower, instead of harvesting his broccoli or his cabbages using a typical straight knife, and give him one of these and keep that wrist neutral and the squeezing diameter larger, we're going to really help him for a fairly low cost, less than $20 here. It can make a really big difference. This is the Cadillac solution, and it's probably the most feasible for someone on a large-scale operation, especially working with woody fruit crops, if it's a pear tree or an apple tree, cherry trees that are being pruned. This is a electric-powered pruner. There's a battery pack that the worker would wear on a backpack arrangement. It weighs about 8 pounds. The trigger on this device can be programmed to be proportional. So if he pulls the trigger halfway, the jaws close halfway. Or another setting would be if he pulls the trigger, the cutting blades automatically snip shut and open back up, a full revolution of the jaws. The cost of this device is about $3,000. So you might ask, why would someone spend $3,000 on a pruning tool when maybe they could go and have carpal tunnel surgery done for $3,000 to $5,000 or $6,000, depending on your medical cost in your community. But consider what Amber told us about the carpal tunnel surgery. It's almost all the time a success. However, you're not allowed to work or use that hand for 3 months. And I don't know what it's like in your states, but many of the growers we work with here in Michigan would really rather not go under the knife as far as having surgery done, and they would prefer to do anything else before going and having the surgery. So when we look at this tool here, one of the options of it is to put a 4-foot extension pole on it, and that would allow a grower to prune up into trees, or a 6-foot extension pole and reach up into the trees without climbing. That's a very valuable benefit of this tool. And when we add the extension pole, say the 4-foot pole, even if someone is working on short trees, now with that 4-foot pole, I can hold this device with 2 hands. I can pull the trigger with my trigger finger if I choose, or the pole has a button on it that could be pushed with the thumb. The position of the button can be modified so that I could press the button with my left hand or my right hand. I could use any of my 5 fingers to push the button. I could slide the button farther up or down the pole and change the angle at which I'm squeezing. The pole is 1.5 inches in diameter, so it's a nice fat gripping surface for my hands. And now we've taken a task that previously required me to squeeze with 5 to 7 pounds of force to close a regular hand pruner. Now I am just pressing a button with a few ounces of force. So I'm still pruning, I'm still clipping off 1,000 sticks, but I have 8 different arrangements that I can do this with my hands. So now we take 1,000 divided by 8, and we have far less repetition with each muscle group with the ligaments and tendons in our hands. And the growers in Michigan who have made the investment in this tool have found that it increased the productivity of the workers so that they could do almost twice the work in the same amount of time, and they have better hand health, getting twice as much done. So now we start looking at a $3,000 investment in a whole different way, that not only are we increasing our health, but we are increasing our productivity as well. So the Michigan AgrAbility program is working right now to help one of our migrant farm workers who has severe hand injuries and issues to purchase one of these and maintain his employment here in Michigan. Using the hand tools anywhere in the farm shop, typical hand tools, once again, just to expand the diameter of that tool handle to make it easier to grip, a softer grip that can be squeezed into with the fingers, can reduce the carpal tunnel pain. This re-grip tool handle grip can be purchased from various locations for $13. It slides over the handle, and then you pull on a plastic tab, and it allows the rubber to shrink and squeeze tightly onto the handle. It could be applied in about 30 seconds to just about any tool, a hatchet or an axe, all the way down to a small screwdriver. We can increase the diameter and the softness of our tool handles. This is another sort of a farmer fix, perhaps. You can go to Lowe's or Home Depot or Menards and buy, or any hardware store, buy this pipe foam insulation that would be used to keep pipes from freezing in the wintertime. I don't know if southern climates would have this for sale, but it's $1 for a 3-foot long piece of this, and it's a rigid foam, can be slipped around a tool handle and then secured with a zip tie or a hose clamp. And once again, we've expanded the diameter of the tool handle and reduced the strain that our hand has to use to grip that handle. This is a modern twist on something that's been used for hundreds of years. I think it was the 1400s when the stand-up scythe was invented over in Europe for harvesting grains. When the Black Death went through and there weren't as many peasants to do the work in the fields, someone figured out that you could have a long-handled scythe and the workers could stand upright and cut down the wheat and the barley in a much more efficient way than the ancient scythe with a short handle that you were bent down. But the new design in the 1400s of the stand-up scythe included a right handle grip. And you can probably picture it if you are thinking of a scythe like what you would see in a painting from the 1700s of someone cutting wheat. There is a handle that sticks straight out the side of the scythe, and that allowed the worker to grip it without flexing his wrist tightly to the side. So for $12, you can purchase a 90-degree tool handle, and now we're allowing our workers with carpal tunnel or arthritis, when they're operating a hoe or a rake or a spade or any other long-handled tool, it can be gripped with both hands, keeping the wrist in a neutral position. And once again, if the worker is wearing his wrist splint or brace, it's going to hold his wrist in the neutral position, and he will still be able to grip this handle and operate his long-handled tools without flexing his wrist at a very sharp, painful angle. Now this device here is a tool balancer. It's a backpack tool balancer. It's a spring-loaded arm that comes up from a backpack and reaches over the worker's head. A cable comes down and clips onto a heavy tool. Even though a pole saw, like you see here in this picture, has a nice 1.5 to 2 inch grip surface, it's very heavy to hold, 17 to 20 pounds out in front of the worker. And those hands are really working overtime to be able to support that heavy tool. And so if we can put this tool balancer on and transfer the burden of the tool from the hands and shoulders down to the hips of the worker, if anyone is a backpacker and has a properly loaded backpack, you can walk many miles without developing a backache because the weight of your pack is carried by your hips and legs instead of your back. The same concept applies here with this Easy Lift harness, and it will reduce the strain that a worker has to put on their hands to hold this tool. So even in the Corn Belt throughout Illinois, Iowa, Minnesota, other states where corn is grown, we have to clear branches reaching over into our fields. There's many farmers in Michigan, whether they're fruit growers or not. You're not just pruning large branches out of an apple tree with this tool, but you would be clearing branches from fence rows along fields so that they don't hit equipment or shade crops. So this tool balancer is, it might not look at it at first glance, but it's going to relieve pain and strain in a worker's hands. And also, if we're going to talk about the benefit of it, if someone has a leg impairment and cannot climb a ladder, we can trim trees from a safe position on the ground. Vibration. We don't realize it, but when we are operating equipment, like Amber mentioned, an ATV, there's a lot of vibration coming through those handlebars on an ATV and the steering wheel of a tractor. There's a lot of low frequency vibration, which actually does the most damage to a person's hands and arms. I have a customer here with Michigan AgrAbility with nerve damage in his shoulder, and one of the most painful things for him to do is grip a steering wheel on a tractor because of the vibration. So here we have some anti-vibration gloves for $23 on Amazon or your favorite store. Probably online is your easiest way to find these. We can absorb those low frequency vibrations in the gel-filled pads of these or other anti-vibration gloves. Also, power tools, we think of using an impact driver instead of a screwdriver, okay? That reduces the amount of twisting that we need to do with our wrist when we're turning a screwdriver. We're going like this. So we'll recommend to our customers with hand impairments, let's get a cordless impact driver that can just put those screws in and out like nobody's business. Now we bring in some vibration. So with power tools that are great accommodations for other types of hand impairments, putting on a pair of anti-vibration gloves will help relieve the pain in the hands for carpal tunnel or arthritis. Increasing the diameter of hydraulic hoses when hitching equipment. Once again, less than $20 for this accommodation. And then we can reduce vibration also in a tractor cab by installing a air ride seat that could dampen a lot of the shaking and vibration and bouncing. If someone has arthritis in their back, a swivel seat so that they can turn and see behind the tractor without twisting their back so much is an accommodation for arthritis in the back. Rear view mirrors. for less than $200. A mirror can be installed. K&M Manufacturing in Minnesota makes this mirror. It's easily mounted on a fender, a cab, other parts of the tractor, so that a farmer doesn't need to twist to look behind him. Added steps. So many of our farmers not only have arthritis in their hands, but also knees, hips, and other leg impairments. Putting additional steps and grabs for a farmer to pull himself into the cab with less strain to those painful joints is a very common accommodation here in Michigan. So Paul already went over the basics of AgrAbility. Here in Michigan, we are supported by Michigan Easter Seals and Michigan Rehab Services, the university, Michigan State University Extension, as well as Farm Bureau and other private donors and industry groups, organizations, and we're able to help the farmers and growers all around Michigan to acquire accommodations like those that we've shown here so far. So in conclusion, I'm going to turn the presentation back over to Amber to close. If you have any questions for me, feel free to put them into the chat window or at the question and answer session at the end.
All right, well, thank you very much, Ned, for going over all of the assistive technologies. I think it helps for everyone to be able to see some of those images and some of the tools that we're talking about. And if you have any questions about any of those tools after this webinar, please don't hesitate to contact either Ned or I and let us know how we can help you with that. So just as a wrap-up before we go into the poll questions, just knowing that carpal tunnel is a very debilitating disease. It is often associated with arthritis, but is not technically a form of arthritis because the actual carpal joint is not affected. It is just simply the narrowing or the pressure and tightening of that tunnel area and that ligament on the median nerve is what's going to cause pressure. So just kind of be on the lookout for those signs and symptoms, like the tingling and numbness and pain that you'll associate in the wrists and fingers and sometimes in the forearm. And know that it is a serious enough disability that it is going to affect your day-to-day life, whether that's on the farm, in your office, or in your home. There are a lot of limitations related to carpal tunnel, and it is something that you need to see your physician for. So with that, we would turn it back over to Paul, and we have, I know, some poll questions, and if there are any other questions, we'd be happy to answer those for you.
So I'll be going ahead and speaking in Paul's stead. We have a few poll questions to ask you. And so if you can go ahead and make sure that when the poll question is pulled up, you go ahead and you click your answer, and then you hit the submit button at the bottom. We can't record the poll unless you hit submit. So if you can let us know what your professional affiliation is. You may fit more than one of these categories, so please choose the category that best represents you. And then remember to hit the submit button at the bottom. And we'll give you a few more seconds to go ahead and answer the question. Go ahead and close the poll, so we'll go ahead and we'll show the results now. And it looks like AgrAbility staff is our biggest category. Now, 12 of you did not submit, so I don't know if that was by design or if you might have forgotten to hit the submit button at the bottom, so make sure to do that. We'll go ahead and open up our next poll question now. The information presented was valuable and met my expectations. Please go ahead and give your answer and then hit the submit button at the bottom. We'll give you a few more seconds to answer the question and then we'll show the results. Paul's back.
Can you hear me now?
Yes, we can hear you now.
Okay. Try this again. We saved all of our problems for 3 days of webinars for the last one, just so you would all have this experience. So thank you for your patience. Let me close the poll and show you the results. Okay. Let me save that. Okay. Next question asks about the technology that was used today. Could you let us know if it was effective and usable for you? If you had any specific problems, if you could please let us know in the chat window, and we will try to remedy them. Give you a couple more seconds on that. Okay, and you can see the results. We have one more poll. That asks, based on today's session, would you attend another session in this series? And while we do not have another session in this virtual training workshop, we do have a AgrAbility webinar series. We have webinars approximately every 2 months. And having participated in this event, you will be on the list to receive notifications of future events. Okay, I'll close that poll now. We will open another poll at the conclusion of the event in case you have other comments or suggestions you would like to add. So if you'd like to do that, please hang on after we finish the questions and answers. And you see the results of that poll. So I will save our results and turn things over to Cliff Raz, who will be doing the question and answer period. So I will mute my microphone and camera and turn it over to Cliff.
Thank you, Paul. Okay, so I'm going to go ahead and share the question screen. And there it is. Okay, so just to reiterate, to send questions in the chat area, go ahead and select everyone in the Send To dropdown so that the questions will go to everyone so they can read them. If you don't do that, they may be sent to someone privately and I won't see them. And then go ahead and click in the box underneath and type there. If you don't see the chat area, go ahead and click Chat in the upper right of WebEx. If you wish to ask a question via voice, just go ahead and raise the hand next to your name, and I will go ahead and enable your mic and you can ask a question yourself. So the first question is, when will the webinar be available so that we can share it with others? Typically what we do is we go through the presentations, and we have to do any kind of editing that we do and get together the closed caption file, and then we go ahead and post that. So typically that's done within a week of the virtual NTW. We have one more question that's been submitted, and so if Amber and Ned can go ahead and enable their mics, that would be great. This question goes to Ned. Are the tools that Ned showed available to source through the AgrAbility website?
I don't know if they're all on the website. You could check on the Toolbox I think some of them are there. And otherwise, several of the products I referenced actually had vendors in the slides. Feel free to contact me if you would like contact information for any of the vendors. Infico USA has a nice website for the powered pruner, and I'm going to send their name right now.
Cliff, I think Ned put up an address for someone. You might want to put that in the window too.
Yes. All right, are there any other questions while I go ahead and get that in the window? There was the name. These aren't the same, but the Infico USA Powered Pruner Company was what Ned just put up, and then the contact that was mentioned earlier is up there on the screen. Okay, well, it doesn't look like there are any more questions, so I will go ahead and turn it back over to Paul.
Well, we're at the end of our 2015 Virtual National Training Workshop, and we thank you for your participation. Once again, if you'd like to make any additional comments, we will open that final poll at the end to allow you to do that. If you have any questions, always feel free to contact us at AgrAbility. The email address, agrability@agrability.org. We will keep you appraised of upcoming events, and thank you again, and thanks to our presenters, Ned, and to Amber, and also to Cliff Rass, who's been doing our technical assistance with the entire series. So we wish you a good day.